My name is James Klim. I've been practicing in Santa Rosa, California for 24 years, but the last 4 have been my best because I've been a CAD-CAM user with the Sirona CEREC system. And having done all ceramic restorations for the last 20 years, because my clients want metal-free restorations, I have a lot of experience with adhesive dentistry. Now I have that control of where I can formulate my restoration the same day by designing it on a computer because I've taken an optical impression. I mill out the restoration, complete it, and bond it in the same day. And so we are really operating at a very high level here because we are able to provide conservative dentistry, which is what our clients want. In fact, this is very patient-driven because they don't want their teeth ground out for a full crown. Number 2 is we're providing the most biocompatible material in the world today. Number 3 is that it's also the most functional because it's made in a very controlled environment. So I'm having a blast as a dentist. It's also providing the creativity that our practice likes. We're very versatile. For instance, if a client comes in, they have a broken tooth, we can fix it from start to finish the very same day. I mean, that's unheard of in dentistry when I was in dental school a few years ago. So this is really providing a new era of clinical application and what we can provide for our clients, and they're excited about it. The clinical applications of CAD-CAM have really been applied well to replacing posterior amalgams, and baby boomers want those out now, and it's the best way to replace those. However, with the introduction of the CEREC AC Blue Cam technology, we are now able to scan the full mouth, which opens us into a whole new arena of comprehensive care dentistry. Now, today in our clinical theater, we're going to be completing lower veneers on a case we've been working on for the last 3 years. Neil, who's actually my chiropractor who keeps me in shape, through our discussions in some of our appointments, I found out that his teeth were quite worn down. And so we found a jaw position that was comfortable for him, eliminating his headaches, and now we're restoring his whole mouth in that new posture. And what I have found with the AC Blue Cam is that the digital optics are so refined that I can design the full upper arch, keep my symmetry down, allows me to have better aesthetic form and function, and gives me all the tools I need to be the best I can. And so having performed this type of dentistry for years prior to my CAD-CAM days, I now have the technology to take it to a level of precision that's unheard of in this industry. In fact, dentistry as a whole. We are now into the 10 micron arena. Think about that. We're now ready to start our clinical procedure, and in the CEREC world, as with if you were using a laboratory, you want to go in well planned. And so we have a study model here with the shape of the veneers that we're going to be projecting into the CAD-CAM unit, and so we'll prep accordingly, and that's how we get good results in a very short period of time. As you can see by our clinical procedure today, that using the CEREC AC Blue Cam is another tool and feature to complete aesthetic dentistry, functional dentistry, precise dentistry, and get this in one appointment. Unheard of in the industry of dentistry, and I'm excited to be part of that because this technology will continue to grow, and I'm happy to be part of that educational system that is now conveying this information to the dental community. The dental community doesn't know this yet, on how precise this can be, and it's one of my greatest joys. Kind of like that little kid in the treehouse effect. I feel like I'm having more fun in dentistry today because I can provide the dentistry in my practice, and as an educator I can take it out on the road and show doctors how they can provide better care for their clients. So it's an honor for me to be part of this industry.